Good morning, everybody. Last day of the conference, but still, I think we'll all make it, really interesting and memorable, so that you can take home some good points from here at the end of the instruction course. So, I'm sure, most of you do good small incision surgeon, because this is like a kind of a stepping stone when somebody wants to convert and master into phaco emulsification or even the other advanced techniques. I think this should be a stepping stone. So when you are doing comfortable small incision, and if you would like to shift yourself to phaco, I think the first thing I would say is start doing little bit small incision on the temporal side. So that will give you a lot of advantages on working from the temporal side, which you would normally do in a phaco emulsification. And start making your side port in the left hand side and start using second instruments through the left hand side, which will help you when you are doing in phaco for rotating and chopping the nucleus. And no doubt, if you are doing a can opener for your small incision, try to master a capsulorhexis when you would like to get into phaco. But the critical issue is to control the size of the rhexis. For a small incision in hard cataracts, when we do, we would like to have a bigger rhexis. But ideally in a phaco, we should not exceed a 5 or 5.5. But if you master a rhexis in small incision, I'm sure you can adjust the size. And learn to rotate the nucleus. I think this is another very important thing which you should learn. Normally we try to prolapse the nucleus. So before prolapsing, it will be nice you dissect, delineate the nucleus and try to rotate the nucleus in the back. So this will really help you when you are doing a phaco. And the other thing which I usually train my residents and fellows to even practice a bimanual when you are doing a small incision. You deliver the nucleus, epinucleus, cortex. You can also practice with, if you have a phaco machine, you can practice bimanual irrigation aspiration in your closed chamber cases. So this is one very critical step, and if you can do the last 40-50 cases of small incision like this, then your transition into phaco will be very smooth. So this is a program which we follow for our residents and fellows. The external trainees have a different kind of program, but basically here it goes through a step of orientation and very critical training in wet lab. But this wet lab training is for a few days in this program, but even before this, for many months, the surgeons would get into wet lab and start practicing, and then it goes on to live patients, and then finally you review their progress. It all happens, this critical program happens in a matter of 2 weeks' time, and then we follow them up very closely for the next 3 months and 6 months, every week giving them 3 or 4 patients. So there is no second thoughts on this. I think the basic begins with understanding the phaco-dynamics of the machine. So I strongly recommend whatever textbook, there are a lot of textbooks on phaco-dynamics. It will be nice if you go through, read that. It can be online, it can be in textbook. But this literature will be a very good step before you start doing anything even in your wet lab. So understand the phaco handpiece, the different tips, the different sleeves, the different sizes which you get. Understand the foot pedal, the positioning, all that. All this understanding can be done in only 2 ways. One is by good reading and then using the machine in a wet lab before you start using it on a human eye. So all the parameters, I think that's very critical. You have to understand the power, the vacuum, the flow rate. I don't want to go into all those basics, but I think this understanding is very, very critical. So just to brush you what you can do in a wet lab, we all think, sometimes wet lab or animations are very expensive. Sometimes there are even $1 million simulators where people try to learn certain steps. But we can really make it very simple. So there are several ways of doing wet lab practice. So like you can use, a lot of people have these plastic model eyes, you can use animal eyes, but we have been practicing for many years using goat's eye. So this goat's eye is really very useful, and it can be very comfortably fitted, into a camera roll or a plastic box. And now we have developed, we made a small micro innovation to that. We have made a vacuum assisted holder, which will be soon available in the market also, wherein you can even control the pressure in the eye. Many times the globe collapses in the animal eye. So this vacuum helps us to even control the pressure. So what we do is, in the goat's eye, you make a rhexis through an incision, wherever you want. The incision can be superior or inferior, wherever you want. You do a rhexis, and this is a good practice for rhexis, but this rhexis is totally different from a human lens. So this is like a pediatric capsule. Its tensile is so high, it's very difficult to do a rhexis, but some practice can be done on this also. So then you little bit remove the goat's lens, some part of the lens, and then if you're doing small incision, I'm sure you all have lot of nucleus with you. So collect these nucleus, keep it in saline. You can keep it for a few days. It becomes little firm also, and then you insert that lens nucleus into this, where you made a crater. You put this nucleus into it. So this will help you, because depending on the density also you can practice. You can start with somebody having NS3. NS2 will be very difficult to push it inside. NS3, and then you can, if you want, you can go for harder nucleus. And you can see you can very well do rotation inside this. You can practice rotation, you can practice sculpting, you can practice chopping. All that can be done. And after that, you close this incision and you make a temporal whatever size you want, 2.8 or 3 or 3.2, and then you can introduce the Phaco probe and comfortably practice all the steps. So I strongly recommend every one of you can do it. And this article came up last year in IJO with the video part is also available. You can read this article and start using your goat's eye to practice all the steps. See there, you can beautifully rotate the nucleus. You can divide and practice, divide and conquer. You can, at a later stage, you can try to chop some of these lenses. So the important point, I think, when you are beginning, so all these are very important to keep in mind. Never select any deep set eyes, especially patients with crowded iris. Shallow chambers are notorious for complications where you have a severe positive pressure. So don't select cases with angle closure, post-iridotomy, eyes with a small axial length. Try to avoid these eyes. And whenever the cornea clarity is not good, when the pupil is not dilating, but once you are comfortable in using other measures, then it is fine. Of course, we may not select subluxated, dislocated, but on table, you can have a case where you see a phacodonosis on table, so call for support. Brown and black cataracts to a great extent to be avoided when you are beginning, and then of course mature and hypomature cataracts. So many of these, sometimes you will be tend to take, but it will be nice if you can do this at a later stage. So ideal cases is something like this, whereas NS2 with a posterior subcapsular cataract, and the NS3 will also be really good, or more of a cortical cataract where you can trench in the center. There will be a good mass in the central nucleus where you can comfortably trench and divide the lens. If you take softer cataracts, again it will be a nightmare for you. There will be a lot of cheese wiring happening, and then you can neither divide nor chop. So you may have to flip and chip or do some other thing, and it will make things difficult. So as beginners, I think you should take cases like this. And this is the ideal way, normally we advise them to proceed. Doing a temporal sclerocorneal tunnel, when you are transitioning from a small incision. So it's like a backup. So if you are not able to comfort a phaco, you can always convert it into a longer tunnel, prolapse the nucleus and remove it. So ideally to start with temporal sclerocorneal tunnel, and then you go to temporal clear corneal, and then maybe you can go for rigid and foldable lenses. And technique wise also, my colleagues would cover that, but basically I ask them to start with divide and conquer, and then go to kind of stop and chop, where you divide into 2 hops and chop, and then finally you go for chop techniques. So this is the rubrics which we follow. The International Council of Ophthalmology, it's an surgical competency assessment rubric, for phaco emulsification. Basically, you score a surgeon very closely in this initial period, which is very important. So a novice would get a score of 2, a beginner would get a score of 3, advanced beginner is a score of 4, and a competent surgeon a score of 5. So every case you should have some observer in case if you have, or when you undergo the training, wherein he is watching and then scoring your steps. So for example, if your axis is circular, somewhere it is running out and you're pulling it back, you can have a score of 2 or 3. So after a certain stage, you can go to 4 and 5, but it's always difficult to get a 5 in rexis. But in other steps, you can, like for an incision or rotating the nucleus, you can gradually improve your score so that you can reach that at a certain level. So this is the score which people get, and you can track it over the number of cases and see where you're going wrong, which step you really need a lot of help and assistance. You will know exactly what you need by tracking your progress like this. So the overall score you can see. And just to finish up, try to avoid cases like this. So this is one of our trainees' cases. You can see when he was trying to divide a brown cataract, what pressure, what force you need to use. And there was a big rupture which was happening because of that one sharp area there ruptured the capsule. And then it was a nightmare. Somebody had to help him out. So in a summary, I think good wet lab practice, understanding the phaco by reading and then using the machine in wet lab, ideal selection, and then master your rexis, hydrodissection, rotation, bimanual aspiration, everything when you're doing the small incision will help you, and start phaco through a sclerocorneal tunnel as a backup, and then go into limbal and corneal tunnel gradually. Of course, start with simple cases, not the soft ones, not the hard ones, the mediocre cataracts, and then gradually go for difficult ones with small pupil and other problems which my colleagues would highlight upon. Thank you.